with you. You guys are going to do an evaluation on this product, okay? So the ask is that when I leave here, we have to have at least 80% of your team trained before your evaluation starts, okay? We're determining where the bridge is located for the evaluation, but they're either going to probably be in room 1 or in this resuscitation room, okay? So handheld rapid infuser, think of it as not taking anything away from you. You guys are still going to have the Belmont, but it's almost like a bridge for those patients that need small gauge catheters. So for the evaluation, these green forms are going to be attached to the outside of the back. If you use one, the ask is that you rip this off, fill this information out, and then place this in Kelly's mailbox. Okay? It looks like a lot of information. Basically, what did the patient look like, size catheter, how old the patient was, and if you liked it or you hated it. Okay? So just be honest. That's what we want you to do. Okay? And then get it back to Kelly, and then we're going to review everything and see if you guys want to bring it in. Okay? So catheter size that you can use Lifeflow with, 24 gauge and above with crystal walls. Okay? As one of the nurse educators, I have to tell you 22 gauge and above for blood or blood product. Okay? What you can give with it. So any kind of crystalloids, and then for blood and blood product, packed white blood cells, FFP, and whole blood. Okay, still no platelets, no cryo. Those would still need their own line. Okay, questions on any of that? Okay, I did get asked about albumin. Because you guys are in the bag, you guys can use it if you need to bolus or push albumin. So PQ is asking about that as well. They are also trialing this product with you guys. So the ask is that whenever you guys are finished using it, keep it, and I'll tell you which portions expire, but keep it and send everything upstairs with the patient. Okay. It goes with the patient. Yep, and I'll tell you kind of the timelines on everything. Okay. For your tubing, Lifeflow is going to be good with crystalloids for 24 hours. Okay, and then you would need to just change your tubing out. If blood or blood product hits the tubing, 4 hours. Okay, so that's if you're sending the patient up to the PICU, and it's been that 4-hour period, you'll just send what we call the handle, which I'll show you in just a minute. It's the working device. You'll send that piece up with the patient. Okay. Other catheters that you can use this on, anything power rated. So ports, PICs, CDLs, as long as they're power rated, you can use them. If you don't know, I'm a nurse as well, a trauma nurse in Charlotte, North Carolina, but if you don't know if it's power rated and the parents can't tell you if they can get contrast through it, I either don't use Lifeflow, or I'll start a peripheral, or you can drill them because it is IO compatible. Okay? The only thing I will tell you with IOs that I have witnessed is they come with that little elbow connector, the patient connection line. Take that off and go straight to the hub with Lifeflow. If you don't, it slows that little elbow bend, slows the rate down. So if you need that maximum flow rate, just take that piece off.
Does that have a restriction on the gauge, so like blood products that go through endos, the IOs?
Yeah. The only thing that I will tell you is the only contraindication that we did not do testing on for our patients is blood under 3 kilos. So if the patient is under 3 kilos, correct. That's why we did not do testing. They need such a minute amount, and there's 62 mLs in our tubing. So you're not going to open up a Lifeflow to give them that blood product, okay? Now they can have crystalloids as much as you want to give them, but it's just for that blood or blood product. Questions on any of that? I know it's a lot. Okay. Package looks like this. Same device is used for both blood and crystalloids. You guys are going to have 5 kits, and that's what this is. And then you're also going to have 5 tubings. Okay, so if you're using blood, they're down here in the patients, and you need to use it longer than that 4 hours, you've got backup tubing that you'll be used to. Okay. In your kit, you're going to have IV tubing. You're going to have an instruction guide, 3 steps on how to put it together. And then there's a QR code down the bottom. You guys can scan that, and it's a video that walks you through it. Okay? Same information on these badge buddies. If you're a badge buddy person, the QR code is going to be on the back. Okay? You're welcome, of course. All right, you're going to have an orange sticker in the bag as well to time your tubing, all right, for that 24 and that 4-hour period. And then this is what we refer to as the handle. Okay, so this is disposable, but it's per patient. So what I typically do is throw a patient sticker on it. I hang mine at the bedside, so then if they're going upstairs to the PICU, send it with them, because if they're out there for 2 weeks, they can use the same handle.
Oh, okay. So the handle doesn't have an expiration?
Just per patient.
Oh, nice.
So
Cool.
just the tubing has an expiration. Okay, 24 and 4 hours. Okay. All right, quick rundown on your tubing. It's gonna look pretty similar to your regular blood tubing. You've got 2 spikes, 2 clamps, you've got your 200 micron filter, okay? Right here, it's gonna start to change. So this is where you're gonna prime the device, and it's also your air safety check, okay? And I'll show that to you. Carry down, and you've got a 10 cc syringe that's actually affixed to the device, not designed to come off. It comes out of the package put together for you guys, so there's nothing for you to do, okay? If you break this off, pitch it, go get another one. Nothing else is gonna go back on there. If you try to put it on there, it's just gonna leak whatever you're infusing all the way around, okay? Right below that, you've got 1 clamp, and then we've got what we call the force reducer. So essentially what this is a balloon inside of a more rigid tube. The purpose of it is for that balloon to swell when you've got those small 24 gauge catheters on the end. It takes the pressure, still rapidly delivers the fluid without blowing your line. Okay, so with that, we've got less than a 1% infiltration rate. And I'll show you how that works as well. Okay, right below that, you've got 1 port. Only thing I caution you guys, push dose only. So don't piggyback anything into here. Great during a resuscitation, push your meds, remove your syringe. When you follow it with Lifeflow, that's your flush built in. Okay, so it goes super quick. Right below that, you're gonna have your patient access. The only thing we ask you is that Lifeflow be that main line going in, and that you're not piggybacked up onto another line. You can use your HUDs, and you can use your extension sets. And I'm checking on your triple and your dual port extension sets that you have. If those are power rated, you will be able to use those. If they're not, I'll let your leadership know so that they can put that message out to you guys. Okay, just has to have a PSI of 300 or greater, and it's not listed on there, so I just need to get with our research and development happening. Questions on any of that? Okay, so to put the device together, all you guys are gonna do is gonna grab your product. If you are not using both sides, you can just leave one of them capped and clamped and work off of one side. If you're using both sides, that's fine. You can have 2 pack cells, you can have a pack cell and an FFP as long as they're compatible and open and going, okay? So you're just gonna spike your back. You're gonna go right here to prime. So you're gonna squeeze this little area, and you're gonna notice that when you start squeezing this blue ball is gonna float. At this time, you want that ball to be floating. We tell you if you're floating, you're floating, okay? So you're gonna squeeze all the way up your first chamber, and then go all the way up and saturate your blood filter. That's new for us. But what was happening was people weren't going at all over this, and your ball was getting stuck down on the bottom, and it was causing you to not be able to flow. Okay? So just go all the way. So right now you guys are primed to right here. To finish priming, you're gonna grab your handle, okay? And you're gonna grab your syringe. Grab your syringe by the barrel so you're not contaminating anything. There is 2 little indentations on what we call the canopy, right here. Those are your pinch levers. So you're just gonna pinch and open, and then it should look like a syringe pump. Okay? Okay, so to load this, the hardest part, this white plunger has to go inside this little blue slot. If you guys load it in front, it's gonna jam the handle and it won't work. So it just has to drop right inside there. And then there's 2 little areas for your wings to go in. And there's only a notch built out on one side for your tubing, so you can only load it the one way. If you load it backwards, your canopy's not gonna shut. Okay? So then you just shut your canopy. Okay? The only time that we tell you that this handle is actually positional is right now. So when you're first priming it, it comes with about 1/4 cc of air in there. So I tell you guys to shoot it straight up to evacuate all of that air, and I usually just say like Charlie's Angels. That's how I can remember it. So straight up, squeeze your lever to release, and you're gonna squeeze it 3 times. So there's 1, there's 2, on your 3rd squeeze, your volume's gonna come out the end, and you're ready to go.
So cool. Okay, cool.
Connect it to your patient, okay? Every time you guys pull and release, you're given 10 mLs. So patient comes in, needs a 200 cc bolus, hook them up, 20 pulls, you're done. I cap mine, I hang mine at bedside, see if they recover. If they do, great. If not, take it down. 20 more pulls, your second bolus. Okay? It's gonna go quick. A unit of blood through a 20 gauge catheter goes in about 1.5 to 2 minutes. Okay? So it'll slow down a little bit with a 24. You're gonna go from about 270 mLs a minute to 145 a minute, but you're still giving it rapidly. Okay? Questions? Okay, I'm gonna let you guys feel it, and I'm gonna go over to troubleshooting things. Okay? Watch that balloon, okay, right here in the center. When I pull, there's not a lot of inflation going on there, right? So that's gonna be like a 20-22 gauge, okay? I'm gonna connect this little 24. So here's that little tiny 24. Putting it on there. Watch that same balloon. Okay. See how it expands? Now when I release it, I'm not touching the handle, but it's still rapidly giving it back to the patient. So what's happening is it's gonna absorb the pressure, still give it at 145 mLs a minute without blowing your line. Okay? The reason we show you this is if I pull with that 24 on and my balloon's engorged, and I try to pull immediately again, your handle's gonna get harder to pull. So what it's telling you is slow down. It's still giving it, okay? If you don't, and you guys take 2 hands and try to force it with that balloon still being engorged, part of the safety feature is that this purple handle is actually designed to break completely off so that you don't rupture your catheter. Okay, so we tell you guys it should not be hard to pull. If it is, the first place to look is that balloon. If it's engorged, just slow down. Give it about 3 seconds. It'll disperse, and then you can pull again. Okay, you want to feel the 24? Okay, you can come over here with it. This has a restrictor on it, so this is going to act like a 22 gauge. Okay, is what this is going to feel like. So what we're going to mimic is we're going to mimic that we're in the middle of a code. All right, so we're in the middle of a code. Doc is hollering at you to give some volume. So go ahead and just start giving volume. And say they're like, give 200 mLs. I'm not going to make you do that, but go ahead. So you're going to be going to town giving this volume, okay? And that's going to happen. So what happened?
Oh, my back right now.
Yes. What's it feel like in your handle?
You can't do it.
Yes. So.
That's cool.
Yes. So what's inside there? Can you see?
The singer? No, it's like, or still, no, there's a little bit of oil there.
Correct. So this makes us super nervous. You've got air inside your syringe. If you look at your tubing, you've got air in your tubing, okay? So what's happened is, as a safety mechanism, you have run dry. You are 100% correct. That blue ball that was floating is gonna suction down to the bottom so you can't pass an air embolie to your patient. Okay, so you can try your handle all day long. You can keep trying it. It's not going to do anything. Okay, all you guys need to do, you're going to spike another bag of product, or you're going to open up your other side. All right, you're going to go right back to where you started. The only difference is you're going to stay above the blue ball, because the blue ball is what's keeping that air from passing down to your patient. Okay, so I'm still connected to my patient. I'm going to go above my blue ball and I'm going to reprime, just like I did to start with. All the way up the first chamber and all the way up that second chamber, okay? Try your handle, still nothing, right? So it's still not gonna let you pass the air. After you've reprimed, there's a little blue word. It says release. You're gonna squeeze where that jelly is that says release. When you squeeze, it's automatically gonna reset your handle. All of your air gets sucked back up into your line and you can continue to resuscitate.
Yeah, that's really cool.
Okay?
Okay, cool.
Questions?